Hi folks, I'm Dr. Shane Cunha, and in this video I will be discussing the components of the cardiac conduction system. There are four components of this system. The sinoatrial node is located in the right atria near the entrance of the superior vena cava. The atrioventricular node is located at the floor of the right atria, while the bundle of His is located in the interventricular septum, and the Purkinje fibers innervate the ventricles, ensuring that contraction is initiated at the apex of the heart, extending up the length of the lateral walls. Functionally, the sinoatrial node is considered the master pacemaker because it has the fastest intrinsic firing rate of 70 to 80 beats per minute. The other components act as relays of the electrical impulse, with the atrioventricular node relaying the impulse to the ventricles via the bundle of His and Purkinje fibers. While all components have an intrinsic firing rate, the rates become progressively slower, with the Purkinje fibers having the slowest rate of 15 to 20 beats per minute. As the master pacemaker, the sinoatrial node is heavily innervated by sympathetic and parasympathetic inputs to establish a heart rate, and since the downstream components are electrically coupled, they follow suit, firing at the same rate as the sinoatrial node. The evolutionary benefit of intrinsic firing rates residing within these subordinate pacemakers is that the heart would continue to contract even if the sinoatrial node was damaged. On the other hand, these subordinate pacemakers, when damaged, may take on a faster heart rate, which would give rise to arrhythmias. The electrical impulse originated in the sinoatrial node propagates to the atrioventricular node via three pathways or tracks: the posterior track, the medial track, or the anterior track, which bifurcates into Bachmann's bundle, which transmits the electrical impulse to the left atria to initiate atrial contraction. When thinking about conduction velocity of an electrical impulse through the heart, it's important to remember three key concepts. First, the conduction velocity varies through the heart. Second, the velocity is slower through nodal cells than Purkinje fibers and ventricular myocytes. Finally, the velocity is slowest at the atrioventricular node, which allows the ventricles more time to fill with blood before contraction. The diagram to the right depicts how long, in milliseconds, it takes for an electrical impulse to propagate across different regions of the heart. The green dot represents the sinoatrial node, and at moment of electrical impulse formation, 0 milliseconds have elapsed. It then takes 60 milliseconds for the electrical impulse to propagate to the atrioventricular node, where it then takes 100 milliseconds to be transmitted to the bundle of His. From the bundle of His, the electrical impulse rapidly propagates to the bundle branches within 10 milliseconds. The impulse also travels very quickly from the apex of the heart through the lateral walls of the ventricles via the Purkinje fibers. These concepts are also represented in the table to the left, in which the approximate conduction velocity and the approximate time to transverse the structure are compared between different components of the heart. Bottom line, the sinoatrial node and AV node have the slowest conduction velocities, while the Purkinje fibers and the bundle branches have the fastest conduction velocities. A tissue's conduction velocity is determined by three cellular and molecular factors. First, the cell's diameter. A thicker cell can mediate faster conduction velocities. Second, the rate of ion channel opening. The faster an ion channel opens, the faster conduction propagates. At this time, I want to mention that an electrical impulse at the molecular level is precipitated and propagated by the movement of ions across the plasma membrane through voltage-gated ion channels, but I'm going to talk about these concepts in greater detail in subsequent videos. Finally, the third determinant is the density of gap junctions. Conduction velocity will be faster if neighboring cells are connected by more gap junctions. Both Purkinje fibers and ventricular myocytes meet these three criteria. Specifically, they are thicker, have ion channels that open faster, and have a higher density of gap junctions. Therefore, the conduction velocity propagates rapidly through these tissues compared to the sinoatrial node and the atrioventricular node. What are gap junctions? Basically, they are molecular tunnels that connect neighboring cells or cardiomyocytes. They allow the passage of ions and small molecules between connected cells such that a depolarizing signal or ions in one cell can easily diffuse to a connected cell to elicit its depolarization. In ventricular tissue, neighboring cardiomyocytes are both physically and electrically coupled at cellular structures called intercalated discs. These intercalated discs have both gap junctions, represented right here, to ensure electrical coupling, and desmosomes, which physically couple the neighboring myocytes. And this concludes my video on the components of the cardiac conduction system.